We have also revised the quantification of the SCTs for this financial year to take this into account and for the increases that we are experiencing. 2 is redistribution of malaria commodities from facilities and districts with overstocks to those with inadequate stock of malaria commodities. 3, we are working with the private sector to ensure that they have adequate stocks of subsidized anti-malarial medication. As you are aware, the Global Fund also supports the private sector. 4, we are monitoring malaria cases, admissions and deaths in all districts on a dashboard and using the data to guide decisions at all levels, and this helped us identify and contain what would have been many outbreaks. 6, we are strengthening the management of malaria by village health teams at community level through training and providing adequate medicines in a program that we refer to as Integrated Community Case Management of Malaria. 7, we continue the routine distribution of long-lasting insecticide-treated nets to pregnant women in antenatal clinics and to children in immunization clinics, and this has been ongoing. 8, we are fast-tracking the implementation of the 2020 long-lasting insecticide-treated net mass campaign, where we shall distribute 26 million nets. 9, we are introducing new channels of long-lasting insecticide net distribution, such as school distribution in selected districts with high malaria burden. 10, in 2018, His Excellency the President launched the Mass Action Against Malaria, a drive for every individual to actively take on malaria preventive services and ensure they are malaria-free. And in this regard, we are working with the leaders to intensify education and prevention. 11, community outreaches in high-burden areas to conduct testing, treatment, and tracking. And lastly, we are carrying out mobilization drives for resources to scale up interventions such as indoor residual spraying and routine long-lasting insecticide net distribution. We have been planning to increase indoor residual spraying beyond the current 15 districts. Right Honorable Speaker, the Ministry of Health would like to inform this august House that the malaria cases are expected to decrease a month after the end of the current rainy season with the above interventions. However, as we are all aware, the end of the rainy season is different in various regions. Malaria is transmitted by the female Anopheles mosquitoes, which normally bite at night after 7 p.m. Right Honorable Speaker, many other bites occur during the day and other times. That is not the female Anopheles mosquito. Research has proven that it only bites at night. An infected mosquito bites a human being and transmits the plasmodium into the blood of the person. The signs and symptoms of malaria include fever, headache, vomiting, chills or shivering, sweating, backaches, body weaknesses, loss of appetite, and diarrhea. The Ministry would like to appeal to the general public to sleep under a mosquito net every night to avoid malaria. Always seek early treatment from the nearest health facility within 24 hours of onset of symptoms. Take and complete the dosage of malaria medicine as advised by the health workers. Use of mosquito repellents are encouraged for those who can afford. Clear all mosquito breeding sites, stagnant water, bushes and broken containers around the homesteads. All pregnant women must attend all antenatal care visits and take the intermittent preventive therapy for malaria. And 7, avoid self-medication and sharing of medicine. Right Honorable Speaker and Honorable Members, a special undertaking being done is fast-tracking the implementation of the 2020 mosquito net mass campaign and distribution so that all Ugandans can have a mosquito net. Government plans to distribute 26 million nets Each net costs about $4 US and an equal amount for the cost of distribution, adding up to about $8 million US to get a net to a person. The total cost of the net campaign will be $104 million US. Procurement and shipping commenced in June this year. We expect the nets in November, and we shall begin distribution in February 2020. Right Honorable Speaker and Honorable Members, I would like to assure the August House that there are adequate commodities for testing and treating all patients. Uganda spends $46 million US on malaria treatments annually. We have adequate commodities like the SCTs, the RDTs, and injectable artesunate for severe malaria at the national medical stores and in most districts. Some districts have excess stock that require redistribution to the ones that are understocked to avoid wastage. I must explain here that many of the districts were not following the statistics. So their orders were limited to their routine orders. So they did not factor in additional commodities for the upsurge. But right now, we are supporting them to order additional medicines to cover for the upsurge. Right Honorable Speaker and Honorable Members, the country is currently conducting indoor residual spraying in 15 districts in the eastern region. In the eastern region, the districts are Tororo, Butaleja, Bujiri, Namutumba, Budaka, Chibuku, Palisa, Butebo, Serere, and Kaveramaido. While in northern Uganda, the districts include Lira, Dokolo, Amolata, Aleptong, and Otuke. That is why these districts don't appear among the districts that are having an upsurge. Although the plan is to scale up indoor residual spraying to 50 highly endemic districts, we are resource constrained. The required funding for indoor residual spraying is estimated to be 235 billion shillings per year if we are using the chemical called Sumishield, which scientifically is called clothianidin, and Fudora Fusion, which is clothianidin and deltametrine. Research has shown this chemical to be non-staining, odorless, lasts at least 9 months, and is also effective on bedbugs. To contain malaria, we need to conduct indoor residual spraying for at least 3 years, but it is desirable to continue for up to 10 years for better results. There are also funding gaps needed for scaling up community case management of malaria and behavioral change communication. As I conclude, Right Honorable Speaker, this August House constituted itself into the Uganda Parliamentary Forum for Malaria in 2018, and this was launched by His Excellency the President. The Uganda Parliamentary Forum on Malaria has since developed a strategy, engaged partners internationally and locally, and are in the process of tabling a malaria elimination bill. I wish to thank all the members of the Uganda Parliamentary Forum on Malaria for their vigilance in the mass action against malaria. And Right Honorable Speaker, I wish to appreciate you in particular for your leadership and commitment towards malaria elimination. Our country is the Pearl of Africa, and it is blessed with climatic and environmental conditions that favor mosquito proliferation and malaria transmission. The challenge is therefore huge, but we believe that together we can. I thank you all for listening to me.
Thank you very much, Honourable Minister. We have debated this a number of times, but I'll just allow a few comments. But I want to join me in welcoming two guests in the gallery, Mr. Mason Van Leuven and Rossini Yu, the students on internship with Engineers Without Borders of Canada. They are here at Parliament and they came to see us work. I think last time it was Honourable Ojara who raised the question. Just a small supplementary.
My submission is about the situation specifically in Kibgum district. which is actually being considered among other districts. We have had so far 21 death cases, Madam Speaker. And there is an unhardened prayer which we are giving to the minister. For example, we are saying the minister should dispatch a team of health workers to go and do a critical assessment, a comprehensive assessment of this situation. And this one has not been happening, Madam Speaker. Secondly, the drugs in which the minister has been stating that there has been supplies of drugs. I can guarantee you, if you went to Kitgum Hospital, Madam Speaker, these drugs are lacking. There is no blood in Kitgum District Hospital. So when we talk about this, and that's why the specificity of the matter now comes. Madam Speaker, Kitgum Medical Hospital is crying up to now in terms of the capacity of the health workers, which is quite limited. And our prayer to Madam Minister is that we should have additional emergency health workers who are able to arrest the situation on the ground there. In Kitgum, we are not looking at it as an upsurge. We are looking at it as an emergency because life is being lost in and day out. So if you are trying to say, it is an upsurge, not an epidemic, Madam Minister, I want to disagree with you. Can you please take the prayers of Kitgum and make sure you address the situation on the ground effectively? Thank you very much, Madam Speaker.
And Madam Speaker, I remember I raised this matter last week, and you ordered that the minister comes with a statement regarding the same. Madam Speaker, I really want to disagree with, anyway, I'm not a medical person, but from the look of things, and from the occurrences of malaria, increased occurrences, in my district, for instance, Agago, where I was told by the medical officers of most health centers in the district, I will mention those that I spoke to. The in charge of Patong Health Center 3 confirmed to me that for every 90 people they test, at least 80 plus have malaria cases. Of every 90, 80 plus are malaria cases. In Kalao Hospital, for instance, they have reported the same, about over 90% of malaria cases and several death cases. And I reported here that there was one single day last week when we lost from Kalao Hospital, in one day alone, we lost 12 children. 12 in one day. And you want to call it an upsurge? Madam Speaker, this is absurd. If I lose 12 children in one day to malaria alone, and we have not counted adults, we have not counted from other hospitals, and someone is calling it an upsurge, I feel so it's really being underrated, and much as I'm not a medical person, but an ordinary Ugandan in Agago and elsewhere will not understand you, Madam Minister. Finally, Madam Speaker, even the health, the local, the private health centers that are in Agago, I give an example of David Fagani Hospital, where I visited, because when I was in the constituency the other week, my last born also, the baby, fell sick of malaria. I went to the hospital, and when I asked at David Fagani, I was told out of every 100, over 90 patients are sick. So it is an occurrence everywhere. In the whole district, almost every 10 people, 9 are sick of malaria. And the worst bit of it, Madam Speaker, is that this parliament pronounced itself 3 weeks ago, and the government, the ministry promised they would start dispatching emergency drugs of malaria to the districts that were affected, especially in Acholi sub-region. And we did actually inform our people to be patient, that drugs were going to arrive starting 31st of last month to the first week of this month. But to our detriment, Madam Speaker, at least the Agago district has not received any single emergency anti-malarial in Agago district for the last, since the pronouncement was made. And so, all patients are forced to move to the clinics to buy Coartem and other antimalarials from private clinics. That is for those who can afford. Now, what about for those who cannot afford 10,000 shillings, 12,000 shillings to buy antimalarials from the clinics? And therefore, Madam Speaker, the lives of our people are at risk, all of us, including myself, because these mosquitoes don't bite you only at night when you're sleeping. They bite. Imagine if you are still seated in the living room or at the fireplace in the evening, you are seated and the mosquitoes come and bite. Even if you slept under the net, it will have already given you malaria. Lastly, Madam Speaker, on blood, insufficiency of blood. The whole of Gulu Regional Blood Bank does not have blood. This was testified by this was a testimony from Kalongo hospital administrator. There was a time they needed only 14 units of blood, but they couldn't get even one. And so we would like the ministry to pronounce itself, because most of the malaria cases have already shown cases of signs of anemia. They report when already they are anemic, and therefore emergency blood would really help in such cases. And therefore we would like the ministry to pronounce itself on these two matters, and the members of parliament from the affected districts may be able to go and mobilize people, even if there is need to go and mobilize to donate blood. Madam Speaker, we would be willing to mobilize to save lives, Madam. Thank you very much.
These anti-malarials, but they still don't cure. So is the minister aware of this? And if so, what are they doing to address it?
Right Honourable Speaker, I would like to seek clarification from the Honourable Minister about three things. One, she talked about the month of February next year, when they intend to have the program fully. And as you are aware, Right Honourable Speaker, sickness cannot wait. And to me, I see that February is too far. Yes, February is too far, and in any case, this is August, and from August, September, October, November, December, January is too far, Right Honourable Speaker, for any illness, an emergency, an upsurge, or even an epidemic, as she explained, could wait. So I just want the Honourable Minister to at least convince this House that it is critical to have the program brought closer so that people do not die unnecessarily. Two, there is the issue of the cost. Talked of $4 for the mosquito net, and then $4 to have it delivered to the recipient. And Right Honourable Speaker, that one comes close to around 30,000 shillings. And these 30,000 shillings, considering the 40 million Ugandans that we have, that means it may not really cause any significant impact. And I thought that possibly the Ministry of Health could work out a mechanism of bringing the cost lower so that many Ugandans can actually benefit from this program. And then three is the money for the campaign, which is $104, Right Honourable Speaker. I think the money for the campaign, in my view, could still be lowered, and then have more mosquito nets procured, and then you can reduce maybe on other items on the campaign for the program to succeed, Right Honourable Speaker. Those are the issues that I wanted to bring forward.
Malaria kills so many people. In my constituency, the cost for funerals has increased. There are so many people who die, and it is most likely that those people die of malaria. Madam Speaker,
I lived in the US for some years, and this is a place where people don't sleep under mosquito nets. I actually asked why this is so, and they told me that one time in history there was malaria in the US, but right now there's no malaria. They sprayed. My question to the minister is, why can't we spray? Why we are spraying indoors, but why can't we spray? Please wait. I'm asking information from the minister. I'm sorry. So I'm wondering why we don't get rid of malaria for good, once and for all. That's my question, madam.
Actually, malaria is on a high rise now in Uganda, but all the same, there's another remedy, apart from the mosquito nets and the spray and the others. There's anti-malaria paint already being manufactured here in Uganda, and it's very effective. It has been tested and launched here in Uganda. The factory is here in Uganda. I wonder why you can't take this advantage, that you can fight malaria through painting our walls internally, and then malaria is eliminated. This paint lasts for 3 years. Yes, you can paint it, the walls. So, Madam Speaker, I would request that the Minister of Health should also find out the best mechanism how to actually apply the mosquito and malaria paint which is being manufactured here in Uganda. And that's my case.
Right, Honorable Speaker, Sironko has 26 sub-counties. 8 sub-counties do not have a health center at all. Unfortunately, the few health centers we have are small, and those are the sub-counties with a small population. Now, these 8 have got a big population. Right, Honorable Speaker, can the Minister tell this House how places like Sironko, who have been waiting for medication in these health centers, who have been waiting for their slot of at least a health center too, which are even being phased out, will deal with their lives because they have actually given out. Someone cannot trek from the mountains down and find no medication in the health center. They just go back home and give up on life. Right, Honorable Speaker, I want to thank you for this opportunity.
Honorable Minister, the upsurge of malaria for the districts you have named, you can't name Sironka and Mbale and leave out Kachumbala, Bukedia in all, which is surrounded by the 2 districts. Ours is the most affected. Honorable Minister, when you talk about the upsurge of malaria, malaria kills, but we want you to tell us what actions have you also upsurged? You have not demonstrated the rise in your activity. You are treating it as business as usual. But malaria is a very terrible killer. By now, you should really clarify to us whether you have sourced for funding. You say you are constrained. Have you sourced for funding from the contingency fund? Because this parliament allocated the funds for the contingency, and this is an area. Can you clarify what action you have taken and whether you have got those funds to manage that emergency? Because this is a super emergency. But if you treat it as business as usual, you are just giving us a story. You see it needs spraying, it needs this. But you should give us the statistics. How much have you invested where? The drugs, the distribution. Now you are saying they have put in other districts more than what they needed. What transfers have you made so far? Say from Kitugum, we have transferred this which is not required to Kachumbala, this amount, and we have saved these lives. So you give us the figures, the statistics, so that we get to know really whether you are serious, because storytelling is not helping us. Yeah, just on history. I thank you.
Now, preparedness and response, as far as I'm concerned, is wanting. It's very slow, and that's the reason why we are losing so many children, and that is very sad. You know, as a mother, as a leader, losing children almost every 2 other days is very sad. And more especially to the rural people who are poor. Treating malaria is expensive. So I urge, this is my appeal to you as a ministry, that you step up in malaria cases. We need more bed nets, we need more drugs, and seriously, we need to train and equip the village health team that are within the villages. We start from there and then you can go to the other health facilities. Otherwise, with your statement, I'll get back to my area and tell my people to wait for distribution of more drugs and bed nets. I thank you, Right Honorable Speaker.
Honorable Minister, you talked about the mosquito nets for prevention of malaria. But the mosquito nets that are being distributed are the insecticide mosquito nets, whereby one needs to wash every time. Honorable Minister, it would be better for the government to consider also distributing the long-lasting mosquito nets, which at least can last around 20 washes. Apparently, the mosquito nets that are in my district cannot even be washed 5 times, and they still have the insecticide. So, Honorable Minister, we don't need to look only at the coverage, but we need to look at the effectiveness and the efficiency of these mosquito nets. These mosquito nets, which are long-lasting, we are aware that they don't require regular treatment, and they are more effective. So I would wish the ministry can consider distributing the long-lasting mosquito nets as opposed to only the insecticide mosquito nets. Honorable Minister, there is also information which you may not be having from one professor called Dr. Professor Ogwar that has some herbal medicinal. I was in one of the workshops by Ministry of Health, and that point came out. Maybe you would pick interest and find out that herbal can be taken as a tea and also controls malaria. Thank you very much,
Thank you, Honorable Minister, for that elaborate update. It is good even my district was mentioned, because last week as I was visiting Bundibujo Main Hospital, there were so many cases of malaria, especially in the children. And the major problem I found there was that we did not have enough drugs and treatment for those severe cases, like the injectable artesunate. Actually, I was even forced to buy some few for some children who were really bad low. My request is maybe even when the districts have not ordered enough numbers, or they order and the drugs are finished quickly, may you please maybe make special considerations, especially on the affected districts which you mentioned here, on the drugs, especially injectable artesunate, which is treating those severe cases. And you find it's a general problem that most people in our rural settings cannot afford to buy, and they are also costly. Then another thing, Honorable Minister, maybe you're not aware of, is in my district there is misuse of the bed nets. It's very unfortunate that when others are crying and we are also crying at the same time, that you increase on the redistribution of the mosquito nets, but in my district, some people misuse them and use them for construction of houses, and others fencing, yes, I've seen this, fencing small horticultural gardens with the nets. So what intervention or what mechanism are you going to put in place to make sure that they are not misused anymore, so that when you bring them, we can appreciate and use them properly. Thank you so much.
One other time someone we saw over the TV launch of a given paint that is supposed to handle mosquitoes. I didn't hear the minister mention something related to that paint. Is it Plascon? We thought that was an area that she could tell us that they have it in Plan 2. Another day we attended the workshop in the Hotel Africana, right Hotel Hospital. We attended the workshop in the Hotel Africana. And there is an NGO that told us they have a plan of manufacturing plastic mosquitoes that are going to eat the anopheles mosquitoes which cause malaria. So I expected the minister also to be in position to tell us that that is also another formula or another plan they have in office that is coming. Right, Esther is so much, Esther, yes.
Right, Honorable Speaker, the information that I wanted to give you is about the company that came here from Sweden when we had the launching here at Parliament. And I remember the minister herself met this company, and they have the products that are doing this, the destroying, the knocking down of the mosquitoes, anopheles mosquitoes. So they work together with the Ministry of Health. They have carried since January, February 18th, May and July surveys in different locations, in schools and also in some prisons. As we talk now, the report is out, and I think it would be very, very good if we'll be able to use this product. Because some of the products they are talking about, the pilot has been done, and I think if the ministry can be in position to put some money in this, to procure these things from, or to use this product to prevent, especially in big institutions. When you look at what the report is coming out with, it is almost at 100%. Thank you very much.
Madam Speaker, my issue is to seek clarification from the minister. I stood here one time and talked about urination of blood of children in my constituency and the district. In fact, even Namisinda district has the same problem. Now, my point of clarification, my question is, the minister told me that that disease is called black water fever. Madam Minister, have you found out the cause of that black water fever? Because as I talk now, the children are still dying. Yesterday they buried one. They have been burying, and the first person to be informed is the Member of Parliament. I'm sending home money for Mabugo every time. Even today, they have told me that another child has passed on. The medical officer in charge of that health center has just told me another child is being buried today and another one has died. Madam Speaker, I gave statistics here of how many children have died in 4 months, 15 of them that time. But there is a continuous death rate going on. I don't know what is going to happen. I've just asked the medical officer. He says he doesn't have blood. I thanked the minister that time. They rushed in, and the NGO Nimbari gave us a fridge for stocking blood, but there's no blood. So these children are dying. We don't know the cause. It is called black water fever, I was told, but what is the cause? It is becoming another nodding syndrome in my constituency extending to Ruakaka, which is the border. What are we going to do? Because children are still dying. And the staffing is a problem in that health center, Madam Speaker. At night, there are no health workers in the health center. So these kids who are brought there just die. There is no way. They take them to these small clinics, and when the minister told me they should not be given Fansida, but when they get there, they don't know even what the nurses there prescribe. So whether it is Fansida, whether it is what, for them they are seeking quick treatment for their children. We are losing children.
But Madam Minister, maybe we can, like my colleagues have said, we can use the VHTs to capture the statistics. At least every village has got VHTs. They can be able to record somebody who has died and roughly of what, so that that statistic can go up to the structures of the sub-county, to the district, and then to the ministry. Secondly, Madam Speaker, the amount for the campaign, that money, make sure you include the VHTs. The VHTs can do better work. So at least the biggest percentage of that money, make sure that it caters for the VHTs. And lastly, Madam Speaker, we have the drugs for malaria. They are too expensive. They're expensive. But we have these drugs like a Panadol for painkiller. Why can't we have the common drugs for malaria at a cheaper price? And at least in every home, every mother has got a few tablets like they have for Panadol. Because once the temperature rises, this mother gives the child a tablet for Panadol. You put also for malaria. Let's have those common drugs for malaria, such that every mother has got those drugs and can give the kids to arrest the situation. Thank you, Madam Speaker.
Madam Minister, the problem we have is that malaria is now resistant to chloroquine, quinine, Fansida, Atenam. What is the ministry doing to find another drug that can cure malaria? Now, the problem we have in our villages is that the people cannot afford to buy these anti-malarials. You find people sharing the drug for one person, and then malaria becomes resistant. So you have a big task, Madam Minister, to send your officers to the villages to educate the people and to try and bring in more malarias, those that can cure malaria, and put in all these health centers. Because the problems in the villages are there. And when you talk of about 820 deaths upside, that's very, very high. And the number is increasing. I talk to people working in these hospitals, and they say in a week the number of people they receive of malaria problems are increasing. So the ministry, what the ministry should do is to put more drugs in these hospitals and health centers. And also to educate people in the villages that when they get a dose of Atenam, for example, the Chinese use Atenam for their soldiers who come to Africa. And it has been very, very useful. I don't know how you have found Atenam in the hospitals in Uganda. That the people must be educated that when they get a dose, they should take it alone. But the problem again is that the medicine is not there in the clinics, and people cannot afford it. Thank you, Madam Speaker.
In almost all hospitals, health centers, there are no mosquito nets. Why don't you start your supplies with those hospitals and health centers? Yes? Madam Minister, that is still a big challenge. Secondly, now you are aware that the supplies is likely to start in February 2020. Recently, I was involved in the exercise, but you could see many of the workers hiding many mosquito nets for their personal, either to sell them off. You should get involved. Honorable Minister, I know what I'm talking about. I've been in local government. What we need to do, identify good people and suppliers. Don't start as if it is a panic. Now we know supplies will start in 2020. Even when you are hiring vehicles, because you have ever hired even mine including, I know, when not knowing that you are hiring from me. But you look for vehicles which are really to do the purpose, not vehicles for friends who are going to benefit out of this exercise, so that we can really kick out malaria. I'm a member of the malaria forum of this parliament, and I know what you have done in the areas, but you have neglected the islands. The islands, you know, for us, we don't use beds. But now, how can I use a mosquito net when in some houses we don't have beds? You must also come up with a motivation system. Yes, exactly. You train them how they can use nets when we are staying on mattresses or on the floor. We did it with the Vice President in his constituency when he took me there. When we are sensitizing people, how you can have a few sticks and the workers so that they can hold the net. But otherwise, get set, don't do it on panic because now you are aware of the time, 2020 February, so that the beneficiaries should all benefit, but not the individuals who supply the mosquito nets. I thank you, Right Honourable Speaker.
The minister has confirmed the increased rate of infection. This means more people dying, the children getting more affected, the poor people getting more affected, but also queuing for a long time to get treatment because the health workers will be overwhelmed. We need to purchase more drugs, but also disengaging the community in socioeconomic activities, because if you have a sick child, you cannot go to dig. That's when I was Speaker. As we are doing all this, we are spending a lot of money and other resources. If there are other means through which we can avert this, through spray, why don't we go for spray and benefit from the cost-benefit analysis from what we are spending as a country? Therefore, I'll request that government takes this up. I was in Adjumani last weekend. Right Honourable Speaker, the rate of infection is too high. As the minister has confirmed, Adjumani is one of the districts affected. The situation is bad. Health workers, some are committed, you are overworked, other people lying, they get tired, go home without treatment. I support the usage of the mosquito nets, but Right Honourable Speaker, some of the factors cannot be controlled. For example, mosquitoes biting you from 7 p.m. How many people go to sleep before 7 p.m.? She has mentioned the continuous raining is a factor. How are we going to control it? Meaning that this is like a disaster because some of the factors cannot be controlled. Therefore, we need to review our mechanisms to ensure that we really avert this situation and have our people more healthy.
As I indicated, we are doing our best to ensure that it is controlled. We cannot change the definition from an upsurge to an epidemic. That is scientific. And so we will handle it as an upsurge. Right Honourable Speaker, we don't have resistant parasites in Uganda. Every 3 years, we carry out resistance studies with support from USAID. There are many resistant on the SCTs. I'm talking about SCTs, not chloroquine, because chloroquine we got it out long ago. There are many resistant countries to malaria, to the anti-malarials, the current ones, but that resistance has not yet reached Uganda. What we are seeing is improper use. People go to clinics, take 2 or 3 tablets, move to another clinic. By the time they go to a hospital, they've been exposed, and we have a challenge treating them. But that does not mean we have resistance. February being too far for distribution of the nets, I have to explain. As I indicated, we expect the first batch of nets in November. We get nets from the Global Fund Against Malaria Initiative as a donation and USAID. All these people have to bring in their nets. 2, we also need to mobilize money for distribution. Currently, we are only aware about money from Global Fund, and that is why we have to give that room for planning. We cannot just say we are going to distribute now when we don't have all the nets and we don't have all the money. The cost of the nets, the $4 includes procurement and the overseas transport up to Uganda. And then there is storage at the warehouses. Then there is transportation and storage in the districts. So it is not that it is just the cost of the net. No, there are many other things factored in. And in our assessment, it is really quite cheap. But as I indicated, we spend $104 million US coming from Global Fund Against Malaria Initiative, DFID is a huge funder, and USAID. Why can't we spray the vector and get rid of Honorable Speaker, you will recall that there was an initiative to spray using the DDT. Many studies were done, and we could not use DDT at that time. Currently, we are not aware of any safe chemicals that we can apply for spraying. The vectors outside, that is indoor. I'm talking about outdoor. So Right Honorable Speaker, what we are doing is we are using what we call larvicides. Larvicides are safe. I don't want to call it a chemical because it is made out of chlorophyll of the plant. We apply it in the water, the mosquito larvae ingest it, and then using the sunlight, they explode using the free radicals or oxygen. And that one is safe. The only challenge is we don't have adequate money to bring in the larvicides in huge amounts. So what we are bringing in now is for areas that are prone to epidemics, like southwestern Uganda, where we will start from and then move to northern Uganda in a stepwise manner. But for us to get rid of malaria effectively, all the countries surrounding Uganda and out of Uganda also need to undertake the same.
Now, honourable members, thank you, Minister. And I want to ask members, please use your voices, use your positions to talk to the people about these things. Now get interested in how our people live. Let's talk. No, honourable members, the other things. No. Thank you, Minister. Thank you very much.